of the PNHP, yes?
Yes, past
Okay,
president.
that's right. And my father's done so much work with you all down through the years, so it's a joy to be with you. And we're up in 10. Hey, Bernadette, how you doing, my sweet? Sending you so much love today. I know I'm coming on at all these different times. Hey, everybody, welcome to the Santita Jackson Show here on AM 950 Radio, the voice of progressive Minnesota. It's a joy to be with you on the 28th day. By the time you hear this, it'll be hopefully not, but it looks like it's going to be the 29th day of the U.S. government shutdown. And the sticking point, at least initially, has been healthcare. Now people are also worried about SNAP, about their food aid. That's $9 billion that will be taken out of the economy immediately, everybody. So even if you don't get SNAP, you will be impacted by SNAP. Rising food prices at the grocery store. Some grocery stores might even be forced to close. But that's another conversation that we will be having. Oh, yes, we are all connected to each other. We learned that. And we learned that during COVID. Some people had health insurance, some people did not. Some people had health assurance. Most of us did not. And when I say assurance, having access to the best health care that is available in the United States and in the world, very, 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 very few people in the United States have access to the Mayo clinics and the Cleveland clinics. And really, some of our best public hospitals, because we have Stroger in Chicago and uh, the system in the county of Cook, where I reside, um, is really a public health system. So no one in Cook County is without access to health care. No one. And that should be the case for everybody, because as we're looking at the US government shutdown, and you have the Republicans saying that this is the Schumer shutdown, and Democrats are saying, wait a minute, we need you to hold health care. We need these subsidies in place. I want to go another way. Something that has not been put into the conversation is a universal single payer system. Has anyone among you had to interact with the health insurance company? And you know how difficult that is. How difficult. How you'll be denied for life affirming and life saving care. Think about that. What if you lived in another kind of system? Other people do. And while no system is perfect, some have been more perfected than others. Let's talk about what it is, not what we've had, but what it is that we need. And no group has stood more firmly in affirmation of your right to have access to the best health care in the world than the Physicians for a National Health Program. They have been there. And they're not in the conversation, they're not being interviewed. And these are practicing physicians who want a national health program because they see the holes in the system, and they want to not just plug them, they want to weave the system together so no one dies unnecessarily. So let's talk about this today. I want you to meet me on Blue Sky, santitajackson.bsky.social, the Santita Jackson Show right here on YouTube, and the Santita Jackson and Friends page on Facebook, at Santita J on X, and that's right, I am on Instagram. I'm trying to get more active, everybody. Please be patient with me. Santita Jackson IG. It's when I had big hair. And I have got one of the past national presidents of the National of Physicians for a National Single for a National Health Program. Indeed, I've been seeing you all since I was a kid. This was one of the tenets of my father's presidential runs, and Bernie Sanders and other progressives down through the years have said, wait a minute, everybody. Ted Kennedy was talking about health care. So let's talk about this. What does this mean? Because as he became ill, he said, I wish, and he saw it with his son who had cancer. Many of you might not be old enough to remember when young Ted Kennedy, uh, but he was found to have cancer. And because his family, because they are wealthy, he was able to have access to the best health care. And I think it sensitized Senator Kennedy in another way. And he became a fighter for everyone to have access to this. And so we thank you, Dr. Anna Malinow. And I'm not going to call you Manilow. You know I love Barry. I said, what the that L? But Dr. Anna Molyneux, who is the former president of the Physicians for a National Health Program, thank you so much for joining us today.
Well, it's such a pleasure. Thank you, Santita, for having me.
Absolutely. And thank you for the work. Thank you for the service that you have done. Physicians for a National Health Program. Who are you? What do you do?
So, Physicians for a National Health Program is an organization of over 20,000 physicians and non physicians across the country who believe in national single payer Medicare for all. I was its past president in 2008. I must say that right now I'm a little bit more involved with another organization called National Single Payer, and we also believe that healthcare is a human right, must be free from profit, and will be achieved through national legislation.
Well, please talk to us about the National Single Payer Program, because that is something that when I first heard about it, of course, I was young and I was under my parents' care. Not that I did not care, but it was not a concern. It was not my concern because I was very fortunate in that I had parents who could care for me. So, you know, there's that. And so many of us don't have that. We don't have that. And you don't really think about it now until you're 26. so,
Right.
so help me to understand national single payer. What does your organization advocate? Because it seems to me that you have become even more specific.
So, a lot of people think that single payer is complicated. It's actually not. In fact, it's used by many countries as the basis of their healthcare system across the world. And the United States is a great single payer system example, and that is Medicare. So single payer is nothing more than public financing. And everybody understands that because we all pay into Medicare our entire working lives. Every 2 weeks, we pay into Medicare, right? As long as we're working, we're paying into Medicare. And that's how Medicare gets much of its budget. It's through public financing. And then what happens is that they collect all this money so they become a single payer, right? And then they pay out for the services that people on Medicare can get, and that's why it's called single payer, because there is just one payer, and then Medicare pays the doctors, the hospitals, the physical therapists, the X-ray, and so forth. And that's really simple. I think it's just one single way of financing a healthcare system. Now, under single payer, kind of like it with in Canada and with Medicare, actually, Medicare happens to be the largest single payer system in the world, actually,
Really?
which most people don't recognize. But
So hold on one moment. So we actually have this system in the United States,
we
but
do.
we don't call it that, and we
No,
don't know that we have that.
right,
But
exactly.
when you come of age and you go into Medicare, it's something that everyone embraces.
Right, exactly. And so what the problem is, of course, is that you have to pay into the system every 2 weeks of your working life, and you have to wait until you're 65 in order to be able to qualify for Medicare. Now, there are other ways. If you have kidney disease, like what is called end-stage renal disease, then you can qualify for Medicare earlier. Or if you have significant disabilities, ALS, then you qualify for Medicare as well. But most people know it as the program that you have to wait until you're 65, and then once you're 65, then you are in this national single payer healthcare system.
So what is it like? I want to ask you these two questions. How does that impact you as a physician? Is it easier um, to treat people in the single payer system, and is it easier as a patient in terms of how we pay?
Well, so the trick here is that what single payer is that it's a financing system. It says nothing about the delivery system. And so when you're thinking about a healthcare system, you have to think about how you're going to finance it, how you're going to pay, and then how you're going to deliver those services. And our single payer system here in the United States, which is Medicare, has a public financing piece of it, but it has a private delivery system so that we have, I know it's complicated, but
Yeah.
but the delivery, meaning that's how you get your access, how you get your health care, is we have doctors, we have hospitals, we have health systems, we have HMOs. Um, we That's who is delivering our healthcare system: the clinics, the hospitals, the dialysis centers. All of those are what we would call the delivery system, and many of those delivery systems are privately owned. Many of them are even investor owned, and so that's what complicates the
So,
whole
so that's the
system.
rub. So that's the rub,
Yes.
that there's still profit in the system.
There is a lot of profit in the system, a lot of profit, even in Medicare, because as many people, particularly right now, are very well aware of, is that Medicare itself, it is also privatized. About half of it is privatized, and that the way that half of the seniors on Medicare get their health care is through a private insurance company that is managing their care. And so this private insurance company gets the money from the single payer system, right, to manage and deliver the care for those seniors. And then they get to decide, the insurance company gets to decide which hospital systems, which doctors. They do things like prior authorization, micromanaging, all sorts of things that unfortunately make it so that even Medicare itself, is not a very simple system.
So if so, am I to understand, or are we to understand, that private health insurance companies are in the middle of the system, the publicly financed system? Is that the rub?
Yes, yes, it is. It is. So they're everywhere. They're everywhere. And the way that I like to think of the US healthcare system, what really helps me, and if your listeners and viewers would take out a piece of paper and a pencil, and I like to think of the US healthcare system sort of like a pie, right? And so you just draw a circle, and then you make a line down the middle, which would be half. So that you divide that pie by half, right? And so half of the pie are people who have insurance through their employers. So that's about 160 million people in this country, almost 50%, which are tied to their jobs, and some people even to their marriage, in order to get health coverage. And so that covers about half of the people here in the United States. So that's half of the pie. The rest of the pie there's a small slice, less than 10% of the pie, of people who are in what we call the non-group market. They still get private health insurance, but they don't get it through their employers because their employers don't pay for it. So they purchase it themselves. It's called the individual non-group market. And those individuals are in the marketplace. And we can come back to that slice because that's what's causing the government shutdown. But before we talk about the government shutdown, we should talk about the other slices of the pie, which are about, say, a little bit under 20% of people are on Medicaid. And that is the system that we have created in our country, the richest country on earth, to take care of poor people. So we can't say, oh, no, we're going to have one system for everybody. No, we're going to have a system for people who have health insurance through their employers, health insurance if they want to pay for it out of pocket. And then another slice, which is still not the whole pie, of people who have to prove their poverty month after month in order to qualify for the individuals and their children and seniors for long-term care to qualify for Medicaid. And then there's another slice, which is almost a slice of the Medicaid slice, and those are people on Medicare, right? We pay for a system every 2 weeks of our working life. We wait until we're 65, and then we get on Medicare. There's a tiny, tiny slice of about 9 million who are the veterans, who have the best socialized healthcare system in this country.
Please
And
explain.
that, yes. So those are the veterans who get their health insurance through the Veterans Health Administration.
Mm-hmm.
That is the best system in this country that unfortunately is, another target that is being privatized and torn apart, unfortunately, but it does cover. It's socialized in that it's public financing and also public delivery. So all the doctors work for the government, all the hospitals are government owned. And that is the difference between Medicare, which is publicly financed, privately delivered, and the VA, which is publicly financed and publicly delivered. And then that leaves another slice of about 26 million Americans, or about 10% of Americans, who are uninsured. Like they have no insurance whatsoever. And so this is sort of this hodgepodge pie. If you've been following with your pencil, it's this hodgepodge pie that is our sort of system of no system. Because the other thing is that just because you're on one slice of the pie doesn't necessarily mean you're always going to be in that slice. You lose your health insurance, you get poor enough, then you get on Medicaid, or now you've got a little bit more money and you can purchase your own health insurance through the marketplace, or you just uninsured, or you wait until you're 65 until you finally land on Medicare. And that is our healthcare system.
It's confusing.
It's confusing, and it's and it's complicated by design. It doesn't have to be this way.
Why by design? What do you mean?
Well, because there's a lot of money to be made there.
Oh.
If you fragment system in this way and you insert all these middlemen, there's so much money. Our healthcare system is $4.8 trillion a year. I mean, that's almost $5,000 billion a year. That's a lot of money.
So a lot of people have put their, they make their money off of our healthcare.
They make their money off of our suffering, actually.
Well, thank you, off of our sickness. I was about to say that, but I said, okay. When you say that, what do you mean, off of our suffering?
Well, because when we are sick, the last thing that we want to worry about are medical bills, our insurance, calling, can we get pre-approval? Is the doctor in my network? That's not what you want to worry about when you're sick or when your loved one is sick. You don't want to be on the phone. You want to be next to the bedside. Or if you're the patient yourself, you want to go to the best doctor possible who's going to take the best care of you, and that you're going to have the best chances of leading a healthy, productive life.
But Dr. Anamalino, that is not what happens. You have to interact with these health insurance companies, and you have to wait. I mean, I know I've been through this. Are they going to approve me? Are they not going to approve me? I really need to get this health care. I need to see this doctor because I've got this specific problem and they're the best at it. And people have died. And they've suffered unnecessarily.
Oh, of course.
I have a very dear friend who had a high wage earning job. I mean, she made a lot of money. But even Venus Williams has had to go back to work. She said, I had to go back on the tennis tour. I need my health insurance. Venus Williams. I mean, really. And so she said, I know we had to intervene on this woman's behalf and they knew that she was between life and death. And it was like trying to pull teeth to get her the care she needed. This just happened a few months ago.
Oh, I believe it. So that's what I said, that people are tied to their jobs for health insurance, or it's sometimes even tied to really bad marriages because that's how they're getting their health insurance. And people do die. 68,000 people die unnecessarily every year in this country because we do not have a national health program. What
happens What happens if these subsidies don't go through?
Okay, so I think this is what why we need to take a look at that slice, that smaller slice that I said we need to think about now. And before we even talk about that slice or the government shutdown, let's talk a tiny bit about the ACA, which also is Obamacare, the Patient Protection and Affordable Care Act that was passed in 2010. And what they realized is that they could do one or two things. They could either control healthcare costs of that pie, or they could just try to make the slice of the uninsured smaller. And the nice thing about looking at our healthcare system like a pie is that it's really simple geometry. And that if you make one slice bigger and then you make another slice bigger, then by definition, the other slices are going to get smaller, right? And that's exactly what the Affordable Care Act did, what the ACA did. It had an employer mandate, so it made that slice of the pie of the employer slice bigger. It created these marketplaces so that it would make it easier and more affordable for people to purchase health insurance on their own. Those were the exchanges. It expanded Medicaid, right? So they made that slice of the pie bigger. It did nothing to Medicare and nothing to the VA. But as a result of the other pieces of the pie getting bigger, then the uninsured just got smaller. Mm-hmm. And that's what the Affordable Care Act did. And it worked because we used to have 50 million people uninsured. And almost overnight, it fell to 25 million uninsured in this country as a result of the ACA. Now, it wasn't overnight because, as you know, states sued and it had to go to the Supreme Court and blah, blah, blah. So it took a few years. But by the time that all was said and done, it did decrease the number of uninsured. Unfortunately, what it ended up happening is that it did nothing to control healthcare costs. And as a result, people had health insurance, but not the health assurance that you're talking about, because many of them end up having sort of this junk insurance, meaning, yes, they had health insurance
technically
in name, but really the deductibles were terrible. And that's what should bring us back to that little slice of the exchanges, which did go up. I mean, it went from something like 8 million people to 11 million people. And that allowed individuals in the individual market to purchase health insurance, private health insurance that would be subsidized by the government. So basically, if you think about it, when you have an employer sponsored health insurance, it's your employer that's subsidizing part of it. Right? They can subsidize 50% of it. They can subsidize 75% of it. They can subsidize 25, whatever, however good your health insurance is. But it's your employer that's paying part of the premium, and then you pay part of the premium. And those are the monthly premiums that then give you some health insurance. Now, in the individual market, you don't have your employer doing that. But what the ACA said is, okay, well, instead of the employer paying that share, it's the government that's going to pay for that share. And it'll depend on your level of poverty. So if you're a very low income worker, right, you make too much to qualify for Medicaid, but your employer isn't paying you your health insurance, then if you're a low income worker, the government is going to pay a bigger share of that subsidy, which became known as a subsidy. And if you are a higher low income worker, then the government is going to pay a smaller share. And they decided that it would pay for people up to 400% of the federal poverty level. And so that's how the subsidies were created. And they helped people for sure. But the problem is that while the government helped pay for the premium, they did nothing to pay for the deductible. And the deductible was thousands and thousands and thousands and thousands of dollars a year. And not only did you have to pay for the premium, and then the government paid their share of the premium, but you also had to pay for a huge deductible of thousands of dollars if you had your family in these exchanges before the insurance company paid a penny for your care. Yes, exactly.
Yes, and for people who cannot see me right now, yes, my head went to the side. And then, really,
Really, exactly. And so that those were the subsidies up until the pandemic. And then during the pandemic, President Biden and Congress passed, the big COVID bill. And what that did is it enhanced the subsidies so that the government said, okay, we have so many people who are losing their health insurance through their employer. Some people are not getting Medicaid. So let's go ahead and be more generous with those subsidies. Let's enhance those subsidies so that people don't have to pay so much of their income because they're losing their jobs, right? So much money to pay for health insurance. And the government stepped up and became so generous that sometimes people's health insurance premiums were $0 a year. $0 for these enhanced subsidies.
is that a
But
bad thing?
it's a great thing, but it did nothing about the deductibles. And so like an average family of four could end up having a deductible of $18,000 a year. They had zero premiums, great, but that's still $18,000 a year that's coming out of their pocket before the health insurance kicks in a penny. So while the enhanced subsidies were great, especially if you didn't need health care, right? Because you didn't have to pay any money every month and you could still get, relatively good health care, except, if you had a catastrophic illness or anything like that, then you would still be responsible for paying that out of pocket deductible. But the problem is that they said, okay, we're going to enhance these subsidies through the pandemic, and then they're going to end December 2025. And guess where we are today?
December 2025.
Almost.
Yeah.
And that's what the fight is about. The Democrats are saying we need to permanently expand those enhanced subsidies so that people continue to pay $0 for their premiums, and the government will pay that share, which, by the way, is going to cost the government $35 billion a year, because that money goes straight into the pockets of the private insurance companies that are providing this healthcare.
Wait. So I thought there was a rub.
There is.
Deep rub. So because the health insurance industry, it has been reported they really wrote ACA.
They did.
They did. So they're the beneficiaries.
Exactly.
What happens if we take them out of it?
Well, that's exactly what we need to do. That's exactly what we need to do, because, while the Democrats are saying we're protecting healthcare, really what they're doing, and there are 24 million people who are in that slice who stand to either lose their health insurance altogether because it'll become astronomically expensive. And the reason it's becoming astronomically expensive is because the federal government, during the passage of the ACA, never said to the insurance companies, okay, well, we're going to give you these subsidies, but you can only increase costs 3% per year. Well, instead, they've increased like 60% since the passage, since 2014. So that's the problem. All of this money has been going to private insurance companies. And that's the reason why we spend $4.8 trillion per year, why we spend almost twice as much as any industrialized country for healthcare, and do not have the best outcomes for our money. All of that needs to be removed. We have to remove the profits, the health insurance, all those middlemen, the investors, the venture capitalists, the private equity. All of that needs to be removed from our healthcare system so that the money that we pay as taxpayers for our healthcare goes for our healthcare and not to line the pockets of corporate insurance CEOs.
We're talking with Dr. Anna Molyneux. who is she's the past national president of of Physicians for a National Health Program, but you are now active with the National Single Payer Organization. What you're advocating for? What?
We are advocating for a national single payer, improved, expanded Medicare for all, and that means all, everybody in, nobody out, free from profit. So there's a bill in Congress that was introduced by Pramila Jayapal that has, I think, 116 co-sponsors, which is the improved Medicare for all. It would be a great bill if we were to pass it tomorrow. I would be the happiest person because then I could go back to reading novels and gardening. Okay, and taking care of my granddaughters. But the problem is that the bill that she based it on, which was John Conyers' original bill,
Yes.
676. What that provided for was the conversion of for-profit health facilities into not-for-profits. So John Conyers had removed all profit from the delivery system.
So when you say the delivery system, what does that mean?
So those are what is providing our healthcare: the providers, the hospitals, the health systems, the clinics, the doctors, the pharmacies, the pharmaceutical companies, all of those that are providing healthcare for us. That's the delivery. They're delivering healthcare for us. And right now, that is in the hands of not completely, but lots of for-profit private ownership. And that needs to be converted into not-for-profit so that we're not paying private equity investors for our healthcare.
So who are just help me to understand who the players are here, because as we're watching this fight over the government shutdown, and we're hearing that, and the Democrats are saying, look, we're trying to save healthcare, and Republicans are saying we just need to reopen. People are afraid, and the exchange is about to open in a few days. First of all, I need to explain the exchange and what is supposed to happen on November 1st, because the government is closed, and the fear is that healthcare is going to cost more. Is that true?
Yes. Oh, absolutely. Because what's going to happen is that because the government is shut down and these enhanced subsidies are going to expire, then the subsidies will go back to the way that they were before COVID. So the government is still going to pay a share of those premiums, but nowhere as much as a share that they've been paying for before. And so the Democrats are saying what we need to do is to continue to enhance those subsidies so that people don't get sticker shock by having to pay more money for their premiums. Mind you, the government is still going to pay a share of those premiums, but because those premiums have been increasing year upon year upon year upon year, people haven't seen that increase in the exchanges, right, in the marketplace. Those are the people that are paying for health insurance on their own, right? Mm-hmm. But with the government helping, with the government subsidizing. So health insurance has been going up and up and up, as everybody knows. But people, honestly, in these exchanges who were lucky enough to have really low premiums haven't seen that increase, except, of course, in their deductibles. But month on month, they haven't seen that increase because the government has been paying that increase.
Mm-hmm. Who is lobbying then? I mean, so just very quietly, what is interesting is that in this discussion, I've not heard the corporate media, I've not heard even elected officials talk about the role of the private health insurance industry and the profit motive. Is that is that a real part of this? Should that be a part of this discussion?
100%, 100%. And that's why I say that as single payer activists, we really are between a rock and a hard place. Because, yes, come November 1, what's going to happen is that people are going to be getting notices that their health insurance premiums that used to be $0 are now going to be $300 a month, or that used to be $10 are now going to be $1,000 a month, or whatever. They are going to have these huge increases. And so, as single payer activists, do we want that? No, of course not. We do not. We want people to be able to have healthcare free at the point of care, and to be able to pay through progressive income tax so that everybody has healthcare. So what we're saying is that yes, they need to be expanded, not permanently, but as you fight for these exchanges, the 24 million people, what you need to do is to fight for the 350 million people in this country, so that everybody is in and nobody is out. We need an improved, expanded Medicare for all, free from profit. You must remove the profit motive out of our healthcare system. We would save $450 billion every year. We would be able to cover everybody.
$450 billion.
We would save $450 billion. And we would not have 68,000 people die unnecessarily every year. But of course, there are huge forces that are fighting that. And so when you ask who is behind all of this, well, it's really kind of funny, because there's sort of this AstroTurf new group that was launched last September to protect these enhanced subsidies. And who's in it? Well, the AHIP, which is the American the health insurance industry, Blue Cross Blue Shield, and they're sort of pairing up with consumer groups, right, that are trying to protect these enhanced subsidies. But health insurance companies are doing it because they know that they're going to be profiting from these health insurance subsidies. Every year they've been getting billions and billions and billions and billions of dollars from the federal government as they increase their premiums to the federal government, and just lining their pockets. And so, of course, they want to continue these enhanced subsidies. Of course, they want to continue the privatization of Medicare, either through Medicare Advantage or even the privatization of traditional Medicare, because that's their business model.
Well, Elder, and I want to go to him, Elder Daryl Prunty is asking a lot of questions. What should we do to pressure politicians to implement a national health care plan, to ensure that every American has coverage? And he went on to say that his brother cannot afford employment health care plans because the premiums are so high. And I mean, and I'm Elder Prunty, I'm hearing you. Trump is a billionaire who gets free government health care. My brother's in Congress, and he has to go on the exchange. But that having been said, it's too expensive. I mean, help me to understand what you think people ought to be doing first.
Yeah,
I mean, what should we be asking for? Because we're not even. This is not part of the reason I was so eager to speak to you today, is that we're in a month into this. At the weekend, at least 42 million Americans will lose access to food. And that's just the people who get the SNAP benefits. We're not talking about their dependents. So I would just add 2 or 3 people to 42 million, and that's 100, that's 200 million people if you multiply it 5 times, because everybody is feeding somebody and somebody and somebody and somebody. You're never just feeding yourself. Very few people are. On top of this, we've got that. And I'm thinking of the people who will lose, who just say, I can't afford it. I can't afford. I'm living from payday to Monday as it is. I cannot afford to buy health care. Even the discounted health care on the exchange, I can't afford it. I can't afford $500-600 a month. I can't do anymore. Does that not what should we be asking for? Because this is not even something that is being offered as an option, Dr. Malino. It's not. No one's even talking about single payer.
Exactly.
Just that's it.
Exactly.
Should we not be asking for that?
Absolutely. We have to raise the demand, especially now, especially during this government shutdown where people are saying we must protect our health care. Well, we don't want the status quo. The status quo is not working. What we need is to raise the demand for a national improved Medicare for all free from profit. Now, there is a bill in Congress, and that's the one that I was talking about that was based on the Conyers bill that is now introduced by Pramila Jayapal, and it's called Improved Medicare for All Bill. It's HR 3069, and it has, I believe, like 116 co-sponsors. And what you can do is you can lobby your congressperson to become a co-sponsor. And if they are a co-sponsor, thank them and tell them they must do more because nobody is talking about it. You're absolutely right. This is not part of the conversation. Even the people, even our senators and Congress people who support Medicare for all are saying nothing. It's all, let's work on the exchanges, let's work on these subsidies, let's shut down the government over this. If you're going to be shutting down the government, shut it down over something important, and that would be this bill, HR 3069, Improved and Expanded Medicare for All. As I said, it's not perfect and it needs to be improved. However, we can at least start there, and you can at least start urge your member of Congress to become a co-sponsor, HR 3069, and if they are a co-sponsor, to start talking about it, to make a big fuss. If they're on, NBC or CNN or whatever, Fox News, have them talk about it.
Well,
This
at
is
town
when
hall
the
meetings.
shutdown should be over.
At town hall meetings.
Exactly, at town
Because
hall meetings.
Dr. Malino, this is not even part of the discussion. And I'm like, wait a minute. Now, if you're going to shut the government down, I'm with you. If you're going to shut it down, don't go back to what we've had. Go over to where you want to be. My great grandmother would say, over yonder. go, go. Well, she made sense. Go over there, because the system that we have right now, the number one driver of bankruptcies in the United States, healthcare, healthcare costs. No, everyone is a not even a catastrophic illness, a chronic illness away from the poorhouse.
Yes.
This is just, and it's amazing to me that no one is talking about single payer. I said, when did this get lost? And I think we were so caught up in ACA, and of course, people were attacking President Obama, and it was awful. And to fully disclose, he's someone I know, and I saw him go through his mother's death. I mean, her illness, her cancer illness. And it was awful to see because he was trying to figure out ways to get her treated. This is someone she had worked hard all of her life. But he was haggling with the health insurance companies. I mean, wait a minute, everybody, this is something that he did, and I watched him do it. And I've got a father who's got Parkinson's now, and he needs another wheelchair. But Medicare is saying, no, we fitted him for this wheelchair a year and a half ago, so we have to wait 3 more. I'm like, 3 more years? Are you serious? He needs the other wheelchair right now. The system, as I see it, and I'm not just saying for me personally, I'm not even talking about the people who cannot afford this. I mean, I don't. We're watching people ration their insulin. if they're able to take, some people are going to animal grade insulin, they're going back there. Just what we have right now, Dr. Malino, is not working. And we're not asking the right questions because no one's bringing it up, Dr. Malino. I mean, at the town hall meetings, a single payer. And what is frightening to people about single payer?
Well, I think so. You've said so much. I'll get to what is frightening in a
I'm sorry,
minute.
I'm so full because
No. You've brought up such great points. First of all, your father should get that wheelchair because we have enough money in the system, $4.8 trillion. I think that we can afford one wheelchair or thousands and thousands of wheelchairs. The problem is that 30% of that, of the $4.8 trillion, goes to administrative waste, which is required to generate profits. So we have enough
for
money
the
in the
companies,
system.
for the health insurance companies, administrative waste is that it?
Yes, of the insurance industry, exactly. Now, and you're absolutely right, it's not working, and we need to be asking a different question, and that is not whether we can enhance these subsidies, if we can have more crumbs. No, we need to raise the demand. We need to put single payer back on the nation's agenda because it's not on the nation's agenda. Now, what frightens people about single payer? It's kind of interesting because I don't think anybody is frightened by Medicare.
No, everybody's looking forward to getting.
Exactly. They just want to last those 65 years so that they can get on Medicare. So I don't think that
well, let me
people
just
want
go
us
this
to be
way.
frightened.
Socialism, communism, government run, is you won't have any option. You won't be able to go to your doctor. Is that true?
Well, once you're on Medicare, and Medicare is not perfect by any stretch of the imagination because there are so many gaps. There's really no dental, hearing, vision. There's no long-term care. You have to purchase a Part D in order to get your prescription drugs, and then you don't get them all covered. So there are too many gaps, too many cracks. So what we need is an improved Medicare for all, obviously, and it needs to include long-term care as well, because otherwise we have to spend down our income and become poor enough to qualify for Medicaid to pay for a nursing home. It's just an insane system that we have. And the frightening part, I think, is that, I guess with Medicare, it's not perfect, but I think that if you explain to people, single payer is just Medicare. It's just Medicare. And what we need to do is to expand it to everybody. We need to improve it so that there are not all those gaps. And we need to take the profit motive out of there.
Are the gaps there to give the insurance companies and the for-profit system an in into the system?
Yes, 100%, because, Medicare itself is another pie, and half of it is privatized through Medicare Advantage, and the other half is the traditional Medicare that is fee for service, meaning you go to your doctor performs a service, that doctor bills Medicare, and Medicare pays the doctor directly. There's no middleman there of the insurance company that gets the money, that gets to decide what hospital and what doctor you get and when and if. So the Medicare, I've even forgot your question. I'm sorry.
No, I would just, when I'm looking, because you've referenced the holes in the system.
Oh, yes. You asked about dental, hearing, and vision.
Well, and it seems to me that all these holes exist so that the for-profit companies have an in into the system.
Precisely.
I mean, look, they wrote ACA after all, right? So I'm just saying they wrote it not to help me, but to help them.
Exactly. So the holes exist, you're absolutely 100%, so that they would be filled by private health insurance. So, which is insane because under Medicare Advantage, you purchase those, or you choose, let me just say it, you choose a plan that can give you hearing, vision, and dental. limited as it is, but traditional Medicare is prohibited from offering dental, hearing, and vision.
Why?
Well, who writes the laws?
They do. They do. They do. You know, I only have a few minutes left here, but I could talk to you forever. The National Single Payer Organization wants and needs us to do what? And I'm asking you this because now you've got Congress persons from both houses who are at home, and you have, or they're in Washington. Well, they're going to be home, and people want to know about this government shutdown because it is. It seems to me that those in power are willing to let this go for a long time. I mean, and they're willing. They want to starve people out, and I'm seeing some cracks here because I'm in Chicago, and there are at least two members of the Illinois National Guard who are saying, I'm not going to go into my community. I didn't sign up for this. And they are also running for office, interestingly enough. But they said, I didn't sign up to do this to my people now. And I'm seeing people, I think people are now, the doors opening, Dr. Malino, for people to ask the right questions. You know, because the system's being unplugged. If they're willing to starve people out, these people will do anything. There's a contingency fund for SNAP that should have $9 billion, but $5 to $6 billion are in it. But I've got a president who is writing a check for $20 billion to Argentina. He's giving them our beef. We're going to import beef, and the cattle farmers in the United States are going to go hungry, if you will. And I have to be honest with you, I'm not hyper partisan about anything. I just want something to work, really. And I don't think that anyone should starve. I certainly don't think that anyone should die. The emergency room should not be where you get an exam. Mm-hmm. You know, Black women are dying. If a white woman is found to be pregnant in the United States, that's almost a death sentence. We have the highest maternal mortality rate. What we've got, Dr. Malino, is not working. No. And people are dying. They're dying with what we've got. And no one is thinking, so wait a minute, there's another way. Many Black men don't get to 65. You know, so I'm like, wait a minute, they don't.
If Black men get to 65, then they live just as long as white men. And you know why? Because of Medicare. Because of Medicare.
Okay.
But the trick is making it to 65. And you're absolutely right. Many, many, many people do not make it to 65. And that is unjust. And that is not the way it should be. And the questions to be asking at these town halls is, yes, people shouldn't have to pay exorbitant amount of money for their health care. What about a national single payer healthcare system? Do you support that? That's the question to ask.
And then the follow-up for us is to do what?
Well, as I said, you can contact your member of Congress and ask them to endorse the improved Medicare for All bill in Congress right now. And if they have endorsed it, is to talk about it.
HR 3096?
3069. 3069. Yes.
69, not 96. HR 3069, everybody. That is what we need. We need to go beyond where we have been and go to where we ought to be. People like Dr. Anna Malino have been fighting this fight really your professional lives. Just before we go, what did you go into medicine advocating for single payer, or what in your practice has really made you be this fierce advocate for a single payer system?
Well, thank you for asking that question. You know, I'm a pediatrician, and so I do not see a lot of patients on Medicare. Their grandparents were on Medicare, but my patients were not. But I lived and worked in Texas for 12 years. And that really is the belly of the beast. And I remember that I, first of all, I had no idea about the US healthcare system, how it was that a child ended up on my exam room on Medicaid. And there were so many instances where I remember making the perfect, correct diagnosis for a child, but then that child didn't have health insurance or the money to pay for that medication, and they ended up in the emergency room, hospitalized, or in the ICU because their parents could not afford the medication. And there are so many stories that I could tell you that finally I said, I can advocate as much as possible for one patient at a time, but what we really need to do is to advocate for everybody. And that's what changed me.
Well, why do you say that Texas has been the belly of the beast?
Well, Texas then, when I was living there, and now has the highest rate of uninsured in the country. And so in Houston at the time, there were 1 million people who were uninsured. And I took care of those children day after day after day. The lucky ones were on Medicaid, but many, many, many of them were had no insurance whatsoever. And there were just instances where children ended up in the ICU and dying from asthma because they could not afford their inhalers, or ended up in the hospital after I had given them a prescription for a pretty common antibiotic that the mother tried going from pharmacy to pharmacy to pharmacy, but didn't have the money to afford, and so came back with sepsis, right? And had to have IV antibiotics. So that's what I'm talking about when I first said our suffering. It's our children's suffering. I mean, I saw it in children. And I said, I cannot work in a healthcare system like this. I must change it.
Thank you for your service. Thank you for your work. How can we support the National Single Payer Organization?
Well, thank you, Santita, for all this time that you've given me. People can go to our website, www.nationalsinglepayer.com. And just like it sounds, National Single Payer, payer.com. And you can take a look at all of our webinars, our publications, our workshops. You can, of course, donate to us. We're never going to say no to that, but mostly we want to educate people so that we can elevate the conversation and really just what we've been talking about is demand a national improved Medicare for all, free from profit. And I mean for all, everybody in, nobody out, because there's been a lot of talk about the undocumented and so forth. Everybody in, everybody, documented and undocumented.
Why everybody in and nobody out? Why?
Well, if COVID taught us anything, it's that everybody needs health care. Your neighbor needs health care. The person that's selling you your groceries needs health care. The person who's serving you food needs health care. Everybody needs health care, because otherwise you're going to get sick, and you do not want that. So everybody in, nobody out.
Dr. Anna Molyneux, National Single Payer, everybody. That is the issue today. That's what, as we watch the government going into a month of shutdowns, and the Republicans have dug in their heels. They show no signs of moving. They're saying, open up the government and maybe we'll talk about it, or we can talk about it. That's not going to happen. It's not. You are not going to get what you need. And I don't care who you voted for. You might have who you want, but now you need to get what you need. I don't care who you voted for. Get what you need. And we need a national single payer system where everybody is in, nobody is out. If your neighbor gets tuberculosis, you've got exposure. That ought to concern you. It ought to concern you, everybody. Please, please, please. Support the National Single Payer Organization, Physicians for a National Health Program. Please, please, please. We're going to continue to talk about this, because while we have this moment, We need to be pushing for the things that we need, the government that we need, not what we've had. That's not worked. It's not worked. God bless you, everybody. The Santita Jackson Show will be talking about Ukraine and Venezuela, and I think they're having strikes in Gaza again. Wow. I thought we were having a ceasefire. They said it was peace. Boy, we've got a lot to talk about. HR 3069. Ask your representative, I don't care if they're a Republican or a Democrat, ask them to support it because you need health care. We all do. Everybody needs to be in, nobody needs to be out. I'm Santita Jackson. Thank you, Dr. Anna Molyneux, for being with us today.
It's a real pleasure. Thank you.
AM 9